hernia is when you have a weakness in the abdominal wall or a little opening, and part of the viscera being the intestine or an organ within the abdomen, protrudes through that defect, and it sticks out, and that's what a hernia is. So the incidence of hernias are different. The two most common hernias that pediatric surgeons deal with is the umbilical hernia and the inguinal hernia. The inguinal hernia is the one that's in the groin and extends down into the scrotum in boys. Hernias are very common, and they're one of the most common operations that pediatric surgeons perform. For example, the inguinal hernia is found in about 5 of 100 normal full-term babies.
Which is a groin hernia. That's
which
what
is a groin
parents
hernia.
refer to this as a groin hernia.
Absolutely. This is the groin hernia, the inguinal hernia, and it's more common than people realize. The groin hernia has an incidence, as I said, of about 5 in 100 if you're a full-term baby. But if you're a premature baby, the incidence is much greater. And that's why many premature babies have inguinal hernias. In fact, the incidence in premature babies is about 10 to 15%. And the more premature the child is, if they're about 28 weeks gestational age, well, we all know that the gestational period is a full 9 months. But if they're 28 weeks gestational age, full term being 40 weeks, then the incidence of the inguinal hernia is as much as 35% of children. That's 35 in 100 children will have a hernia.
And then in prematurity, the risk of having bilateral hernias, meaning on both sides of groin, is higher than in kids who are full term.
Absolutely. So the incidence of a bilateral hernia is only about 10 to 15%. But if you're premature, then the chance of having it on both sides is higher.